Device Nation behind the booth at Illuminoss, Craig Decker. Welcome to San Diego, sir.
Thank you.
I'm super excited about your product. We interviewed Dr. Cynthia Emery for a recent podcast.
Yep.
She spoke very highly of it, and I got a chance to be in a case like 2 or 3 days later and just blown away. So walk us through, for people that have never heard of this product, what's the problem that you're solving?
So really what Illuminoss is solving is patients with severely compromised bone, whether that's geriatric, whether that's metastatic, any patient that has very compromised bone where your typical plates and screws and IM nails are not going to work, they're not going to get bite. We solve a very difficult problem with adding just stability in that patient. Again, whether it's metastatic, whether it's geriatric, you can have Illuminoss in there. It goes in through a 7mm opening, so it's minimally invasive, maximally expansive. You cure it, drill through it, put hardware anywhere you want through it, and it just adds that stability where you wouldn't have it without that augment. So it's really a customized augment for these patients.
I watched the material get pushed in, and then I saw the light hit it, and then that patient was good to go. What is the material that you're pushing in?
Yeah, so it's a photodynamic monomer, and once we get the material in, it's about the consistency of honey. When you push it in, you get good cortical contact, you get your x-ray, you get your AP, you get your lateral, make sure you know where you want it, and as soon as everything looks good, you hit it with the blue light, and it's, depending on the implant, anywhere from 5 to 10 minutes curing time. And then once it's cured, that's when you can start drilling and putting hardware through if you need to.
So Craig, what are the primary patient profiles that you're seeing across the country? Who's using this for what?
Yeah, so again, two different markets. So the geriatric trauma market, we're seeing distal femur, periprosthetic distal femur, interprosthetic distal femur, proximal humerus, geriatric pelvis, and then on the oncology side, we're seeing humerus, and then our biggest oncology market is metastatic pelvis, where these patients have these very big uncontained lesions, uncontained defects. And the only other way to treat these patients is to squirt cement in there. Cement can go anywhere. It heats up, it gets really hot, it can crack, it can separate. And Illuminoss is all self-contained, it's inert. And again, it just fills these big uncontained defects and provides these patients just the stability that gets them out of pain that day and gets them up and walking to where they were barely able to sit up in bed before that.
This is a game changer in the orthopedic oncology market, which is just exploding right now with all kinds of new technology. So for people that are watching this, if surgeons want to learn more about it, or if there's reps out there listening that are thinking, you know, this looks like a great product for my bag to call on my orthopedic oncologist, traumatologist, whatever. How do they reach with you?
Yeah, so if you're a sales rep, a distributor, or even a surgeon that doesn't have local representation for some reason, Illuminoss.com is probably the easiest way to reach us. You can also reach us on LinkedIn. We have a very big presence on LinkedIn. Feel free to reach out to us that way, but I think Illuminoss.com is the easiest way to get a hold of anyone here from the company.
It's a great product. I've seen it. I'm sold on it. So wish you guys great success out here in San Diego.
Thank you so much for coming by, and thanks so much for the time.
Absolutely.